Good morning and welcome to Ask Dr. Murphy This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your submitted questions and will be addressing the latest through today, January 30th. If you have any questions or comments, please leave them down below. Today, we're starting with a submitted question from a longtime viewer, and they ask, have there been any studies about why some people get COVID or don't get COVID even though they've been exposed?
This is an excellent question, and it's a fascinating issue in the field because there are so many cases of a couple living together, sleeping in the same room, bed, having close physical contact and relations, and one person gets COVID and the other person doesn't get COVID. This like happens all the time. Family, two people in the family get it and five people don't get it. It's really very common. So it's been of interest. And this data came out from the University College London, very good school, and a group at Imperial College London as well, and was published in the journal Nature, which is one of the top scientific journals. So it's a really top-notch journal. And they showed that some people who were exposed to COVID-19 never develop infection because their immune system stops the virus almost immediately in the nose and the oral cavity where it's coming in to infect the person. And one of the factors they found was a gene called HLA-DQA2, and people that had that genetic it, characteristic mounted a very fast immune response in the nose that prevented the virus from taking hold. And those that others had a much slower immunologic response in the oral cavity, and a lot of those people got sick. So this is just one factor, but it's interesting to note that we found some genetic differences in people being susceptible to the virus. So really fascinating science and good work. So we'll see.
Very, very fascinating. And we will continue to look. Of course, these are very, very intense genomic studies in this case. So we don't really want to get too into the details there, but there is so much interesting information on this topic if you'd like to hear more. But getting into our top stories for today, the US flu activity has declined but remains elevated in the country. Can you tell us the latest?
Well, flu is usually highest in January and February. But it's competing with COVID and RSV. Plus, a lot of people have had the flu vaccine, but it's still out there. It's not like it's gone away. It has started to come down. So this may be a good sign if this continues, that maybe the flu epidemic will go away a little earlier this year than it has in the past. But keep in mind, there were an additional 12 pediatric flu deaths recently, which brings the total for pediatric cases to 44. And overall, there's been an estimated 19 million infections. People got ill from the flu, resulting in 250,000 hospitalizations, because it's very easy for the hospital now to diagnose, like everybody gets diagnosed if you end up in the hospital with a respiratory infection. And unfortunately, there's already been 10,000 flu deaths, and we're like at the kind of the peak or the middle anyway of the epidemic. So it's a very serious disease. It is partially preventable, and the seriousness is decreased if you do take the vaccine. Not too late to take it. And it's still out there. So I think people just should know where we stand with the flu because we're in the middle of the flu season.
And the way we get these data are from the CDC's Flu View report. Gratefully, that has been updated. Unfortunately, however, there are dozens of different CDC trackers that have not been updated in months. Can you tell us about those trackers and what they're mostly focused on?
Yeah, I mean, 90% of these delayed reports or absent reports are vaccine related. So the group in charge now is not, they don't like vaccines. They're anti-vaxxers, basically. They'll do anything to slow it down. And what they're doing is they don't want to look at how much disease is out there because the numbers are going to go up in all these diseases when we stop the vaccines. And they don't want anyone to really know how many people are getting sick. So you just don't report it. It's, stick your head in the sand and just hope you do well. And it's really unfortunate because there are literally 18 diseases out there that are preventable that are now going to be much more common. And people are going to get sick and some people are going to die because they're not taking the vaccines. They're not encouraged to take them, or they have this, oh, you make up your own mind. Okay, that's good for you, but you're talking about public health. You're talking about the entire community that you live in. And we're going to start seeing all sorts of diseases out there, including an example, rotavirus. It's a disease that causes diarrhea, and in kids can be quite serious. And they've changed the recommendation to not make that mandatory or even recommended that it's up to you. But it's one of the leading causes of pediatric hospitalization. And since the rotavirus vaccine has come out, 56 to 70,000 hospitalizations per year have been reduced by 85 to 95%. It's very effective. So, now we're going to increase the hospitalizations for pediatrics. Very,
Mhm.
very sad.
And one thing that we will be able to measure that shows the result of all of this great public and global health work is the rising life expectancy here in the US, at least as of 2024. Can you bring us that data?
Yeah, so this is good. We had, big dip during the COVID pandemic when, there were a lot of people dying from COVID. We had an excess 1.1 million deaths due to COVID. Another couple 100,000 of delayed care for other diseases. And this we're sort of crawling out of that, and this is really good news. However, if you put it into context of our peer countries, in other words, other high income countries, and a lot of them without as much income per capita as we do, we're not doing that good. We're 32nd out of the top 38 high income countries. We're not even in the top 20. We're 32nd. I mean, it's really embarrassing. Now, we're a big, complicated, heterogeneous country, but I mean, this is pathetic, this positioning here. And so overall, we've gotten better, but we still are not doing well compared to other countries, other high income countries.
Mhm. And a
Europe, all
specific
of
area.
Europe, basically all of Europe, you know, Australia, New Zealand, the other high income places. It's very sad.
And another area that we are consistently not doing well in for a calendar year now is the measles outbreak. Lots more cases this week. Can you bring us the latest?
Yeah. Now, South Carolina is still going strong with new cases. There have been a total of 798 cases confirmed in South Carolina, 30 more than the Texas outbreak. Texas is going down. South Carolina continues to go up. It's it most of them are unvaccinated, most of them are children. It's everywhere. Mexico had their first death of the year already. They're in a lot of trouble too, as are the Canadians. But This is a preventable disease that in the year 2000, we had zero cases. Zero cases. Highly contagious disease. You can end up in the hospital. You can get encephalitis and die. There's usually per 1,000 people that get it, somewhere between 1 and 3 die. So it's a terrible thing. And with the vaccination rates going down, this is likely to just never go away. It's going to float around the country and the world where there's pockets of unvaccinated high-risk people. Now, once you get measles and you survive it, you don't get it again. So those people will come out of the pool. But with these kids coming in that are not getting vaccinated, they're very high risk.
Mhm. And on a different note with vaccination, something that's very positive. For now, the third time, a massive study has come out linking the shingles vaccine and potential protection from dementia. Can you tell us about it?
Yeah, so there have been, and we have reported here, results from several other studies that showed that surprisingly, the diagnosis of dementia was reduced in people that had shingles vaccine. Now, there's not been a study for this, so they're observational groups, but well monitored. And this is yet the third group. This, I think, is a Canadian group. And they found that the people that had the shingles vaccine were 20% less likely to be diagnosed with dementia. That's like a gigantic number because dementia is so common. And to have a 20% reduction in the number of dementia cases is really phenomenal. So, hey, you take your chances if you don't take it, but if you do take the shingles vaccine, besides preventing shingles, you have a 1/5 chance less of getting dementia. And they looked at it even further because some people with dementia, of course, they don't live as long. The mortality rate is also reduced. So it's just great positive news and something that an unexpected finding, really.
Mhm. Unexpected great news there. And our final story today, unfortunately, not as great, but a health warning from the FDA about potential botulism. Can you tell us the product and the recall?
Yeah, so botulism, Botox, that's botulism toxin, by the way. Um, if you eat something with botulism, you can die. All right, so it's serious. So there's a product called Genova yellowfin tuna. It had a defective pull tab lid that allowed it to be contaminated. And this was discovered by the company. However, batches of it went out into the public. Now, nobody has actually gotten sick, but if you have that Genova yellowfin tuna, canned tuna, throw it away. Don't try to open it. That can actually spread it. But the symptoms of botulism start with nausea, blurred vision, muscle weakness, and ultimately you can die. I mean, you could stop breathing. So if any of those nausea, blurred vision, or muscle weakness, and you've been in contact with this canned tuna, seek medical care immediately. But so far, nothing has been reported clinically. So this is actually a good part of the surveillance system that remains in place. So that's a positive thing.
Mhm. And just a little question on that there. Normally, when we're reporting on like a salmonella outbreak or listeria, we do hear about this after the fact when there have been cases. Is
Right.
botulism potentially more serious? Is that why they're announcing it before there have been illnesses?
Well, this was like a manufacturing accident. Okay. And they knew it. And then somebody said, well, where did all that the bad cans go? Uh-oh, they got distributed. So this is responsible reporting. And we're lucky that nobody has gotten sick yet. And hopefully the word will be out that, you don't want to you don't even want to open the can. The can, oftentimes with botulism, the once it's in a can, if the botulism takes off, it produces a gas. And so the can actually puffs up. So if you ever seen a can that's bulging, that hasn't been opened or anything, that's classic botulism. And so you don't even want to open that because the stuff can blow out of there when you do open it. Throw it away or take it to the health department or whatever. But you don't want to get near anything inside that.
Mhm. Well, thank you so much for breaking that down. Very good to know. And on that note, I'd like to thank you for bringing us all of these stories and helping us understand them. So thank you, Dr. Murphy.
Well, thank you, Katie, and have a great week and stay warm.
Thank you, will do. And thank you all for joining us this week for Ask Dr. Murphy This Week in Public Health. And thank you for submitting your question. If you have any others or any topics you'd like to see, please feel free to leave them down below or any of our social media linked in the description. Have a great weekend.